Now we'll go to our living and lived experience reflection of the day. So I'm pleased to invite Alex Dangaard up here. So Alex has been working as a drug and alcohol counsellor at Lives Lived Well in Katoomba for the last 2.5 years and a volunteer team leader at Dancewise New South Wales, the peer-led harm reduction service at New South Wales music festivals. With a passion for harm reduction training and education, service delivery design and the development of peer workforce in the AOD space, Alex hopes to make meaningful contributions to service design and broader public health policies in the future that promote agency and reduce barriers for people accessing services.
Cool. Hi, thank you. We are on the home stretch, which is really exciting for us. And I think that, if I can deliver a harm reduction educational workshop to festival patrons on day 4, you guys can come along with me for 10 minutes. Yeah. Look, the younger version of myself who, was accessing intensive AOD and mental health treatment services, really would have thought at the time, what on earth is a symposium? So I'm really grateful and appreciate the invitation to be able to share my reflections with you today. Our challenges here, they start with us, our abilities to admit to not knowing, to be able to unlearn, to rethink, and to reimagine. Gathering here today has been about collaborating and connecting and dreaming about creating our new preferred futures, but just as importantly, about how to let the old ones go. A resounding narrative from my experiences attending these kind of events in these sectors is that our sector's ability to survive, we are surviving being under-resourced and underfunded. But to me, and I'm thinking, to other people here in the room, that is no longer an acceptable measure of success or an acceptable measure of progress in our sectors. We cannot merely just continue to be surviving and adapting to funding requirements in the same way that, our workforce, who works directly with our consumers, aim to support our consumers to move forward beyond survival and foster hope and action towards thriving. To thrive, it demands collaboration and co-design between our sectors to envision new futures and new identities. Collaboration and co-design and these kind of buzzwords, they're meaningful when we are courageous. When we're courageous enough to take ourselves out of our comfort zones, have really honest discussions and ask difficult questions. Harnessing our individual and collective courage and vulnerability is imperative for the imagination and innovation to be able to take the next steps in bettering our service delivery, in bettering our models of care, and embedding the policies that will support this to happen. It's an exciting time for our sectors. I dare say it has been an exciting time for a while. I think 10 years ago it would have been exciting as well. We find ourselves evolving, growing, stretching in all directions of our work at all levels of service provision. And we are doing this really quickly through workforce development and capability, law and policy reform. Things are really moving and they are moving quickly. The mental health and AOD sectors have always sort of coexisted. And as Evelyn acknowledged earlier in the day, I think many of us in the room experience our sectors in isolation. Adding in the development of the emerging lived and living experience workforce, I can't say that this coexisting has been a particularly comfortable space to be caught in, both as a professional and as a consumer. I'm a clinician whose practice and professional values are informed by my passion and experience of also working within services and initiatives that are developed, led and run by people with lived and living experiences. I can tell you that working in these initiatives, working alongside people with lived and living experience, this is a restorative experience for me. It's a comfortable experience for me. The people that I work with, our trust is built on shared values and shared visions. And so we kind of just get on with the work. You know, we're not tiptoeing around, you know, potentially creating more silos within our work between clinicians, you know, and people with lived and living experiences. Something, you know, that my colleague pointed out to me today as we were reflecting on this morning's content was language that she noticed. You know, the sort of language that we were using around mental health service users with mental health needs versus AOD service users having AOD issues. You know, I think, and we agree that, like, while well-intentioned, our language and the nuances of that really impact how we deliver, you know, our services, and how our consumers, you know, frame their challenges as what is workable and what can be changed. You know, my practice and values are you know, informed by my own experiences of accessing a range of intensive services. I'm, you know, where I commonly relate to the shared experiences, shared stories of consumers that I'm privileged to witness, and that I'm sure many of us have heard from our consumers as well. You know, we know that the tale is old of time, you know, in contemporary AOD treatment. You know, substance use doesn't occur in isolation, you know, and I also don't know of many people who have, you know, challenges with their mental health who haven't at one point used alcohol or other drugs as a way to cope. So, you know, despite our well-established understanding, you know, of the prevalence of co-occurring mental health challenges and AOD use, you know, it is my view and experience that the nature of our sectors merely surviving and coexisting has a long way to go in reducing the common experience, you know, of consumers being bounced around between mental health and AOD services. Consumers being either labelled as too complex or too functional in order to access that service. You know, we have a long way to go in appreciating, you know, the gravity of how vulnerable it is to be in the position of somebody who is accessing services, particularly residential or inpatient settings. We have a long way to go in supporting our consumers, you know, to build agency and build self-advocacy skills in order to be able to better navigate systemic settings that have often perpetuated harm. You know, ultimately, I hope, you know, and I want for consumers to be able to receive treatment and interventions that minimise harm, treatment that matters to them, and treatment that is relevant, you know, to their unique contexts and circumstances of which they find themselves in. And this is why gatherings like these today are so important. You know, we need to be creating opportunities to bring us together, to bring people into the room who have diversity in their experiences, their perspectives, their backgrounds, you know, so that we can really make way for creativity and innovative solutions. But more importantly, to be able to connect through stories and shared experiences, which we have been so lucky to have heard so many of these today. Again, my hopes are, and I hope that they are shared, that ultimately our sectors are able to collaborate from a place of curiosity and from a place of courage to build a shared understanding and foundation, and really, you know, work together to, you know, define what we say, what we mean by integrated care. Because I think if you asked, you know, the AOD sector what they think integrated care is, they would say holistic. Whereas I think if you ask mental health what they see integrated care is in this sense, it might mean collapsing of services together or co-locating them together. We need to have a shared understanding and a shared vision from which we work on in order for our multidisciplinary sectors to be able to find a home together and find a home together with lived and living experience voices. And to me, this means that people working in all levels of our sectors really, really, really listen to the voices of our consumers and engage in meaningful, proper, actual co-design to genuinely value, amplify and prioritise the work of our emerging lived and living experiences workforce. And to not also, underestimate the impact of removing simple barriers, whether they are organisational policies or processes. These are the things that are gonna unlock our creativity, our innovation and our problem solving so that we're able to move from surviving and coexisting to actually finding solutions as a sector together. Yeah, at the same time, my hopes are that the people who do have the power, who do have the influence, have the courage, have the courage to be accountable in bridging that gap between evidence and practice, to use their power to drive culture change within organisations, to value and prioritise lived and living experience voices. Our leaders need to be thoughtful and stable, and create stable scaffolding for change and that environment to be realised. Our leaders need to invite consumer and workforce feedback and be responsive to when our services aren't being received well, even if we think that we are delivering them well. We need to keep looking for ideas, innovation, and continue to adapting, to our consumer needs and not just their issues. So I'm really encouraged, by the time that we've all taken today to engage in these sort of conversations and knowledge sharing and these discussions. I would like to thank Jennifer, Michelle from NADA, for inviting me to share my thoughts on today. Personally, it's been a little bit of a nice full circle experience for me, where I know that I can stand here and say that I'm really proud to have become, the person that the younger version of myself would have been really grateful to have met and to be able to share this moment with you today.